Okay, so good afternoon, everyone.
Good afternoon.
My name is Allan, and I'm here to take you through this process of doing a search in the Medline database. And I'm here really to guide you through this process and to provide you with some examples of
Sorry, everyone. I accidentally muted Allan. Hello, Allan. Hi,
Hi.
Allan. Sorry, I muted you by accident. Yeah, just like 10 seconds ago. So please continue. Maybe rewind to just previously. Sorry. Yeah, go ahead.
I'm here to introduce you to Medline at Hong Kong Baptist University. And a place which is a good place to start is really to know how you get inside the database. And so if I'm here at the Hong Kong Baptist University Library website and I choose databases and I select from the alphabetic list, M for Medline, what I will be taken to is this page that you see here. So there are 15 databases which begin with M, and the one that I'm interested in is here at the bottom of the page. It's Midline on Ovid. There is some descriptive information on this page, and it lets you find out more about the databases that you're going to use. But to go through and into the database, you just choose its name, and that will link into the material that is from this page. We're going to do some demonstrations really to give you an insight into how to use Medline. And so I've selected some subjects that are maybe a little bit topical just now, and we're going to explore those in just a moment. Let me move through then and see the page that comes up when you are actually inside Medline. So once I have selected the database from inside the library website, this is the page that opens up. And so at this point, I want to give you a little bit of a guide to this page. Up at the top, you can see where your searches are going to appear up in this section of the screen. You can see other options across the page, but during our session today, we're going to be doing searches. So that search button is enabled here, and we're going to use that as a navigation button as well. If I want to go back to the website, I can open it up back here. And there is some help and training information that we will visit a little bit later on as we go through this introduction. A bit further down the page, you can see the different methods of searching across the screen. So here they are across the middle of the page. And as I choose that individual item, the screen is going to change, and it's going to give me slightly different opportunities to find the information that I'm interested in. Down at the bottom of the page here, you can see in this blue area, and then behind this button, that there are limits or ways to narrow down your results. We're going to explore these more completely later on. And next to the center of the screen here, if we need to, we can open up a little guide. This guide gives you some information about the database that's open. It will let you know how it's divided up and all of the detail that's inside. We don't need this yet, but we can show you later on where this all comes from. I'm looking now at basic search, and this can be a really good place to begin to explore. Searching for information within a database if you have never done this before, basic search is really useful, particularly if you are faced with a question that you have never faced before, because it gives you a place to begin. One thing that it isn't, though, is it's not a research style search. We're going to do some more of that later on, but it can be a good place to begin. And indeed, this is where I'm going to start so you can begin to experience how this software works. As my example, I'm going to put in a subject or a question. Using masks to prevent SARS, or sudden acute respiratory syndrome. You may know of this from the past. One thing that this basic search approach does is it allows you to type in a whole subject or a whole question and to see some relevant choices that are about this particular topic. By using this example, though, what I'm hoping to do is really to show you the type of information that is inside Midline. Midline is all about journal articles and journal references, but it is also a quality filter. The journal articles that are inside Midline are quality publications. So this is really a good thing to know. And the other thing that Midline represents is a way to establish a subject so that you can use it in a variety of different ways. This is the question that I asked. I'm interested in using masks to prevent SARS. And as I scroll down across the page here, you can see the journal articles that appear that are about that subject. Each of these items that you see here is about a journal article of various types, and in amongst the material that you see, you may also see little links like this, which represent access to the journal articles themselves. We can see how that search works because there are subjects that are described here. So even though I typed in a question, it's interpreted that question in a variety of different ways. So it has searched not only SARS, the acronym, but also severe acute respiratory syndrome, as we see it there. As I scroll down the page, though, you're going to see these journal references. You're going to see the title of the work, you're going to see who wrote it, the journal where it appeared, and information about that particular item. If I'm interested in any of these, we can open up the abstract to see more information about that article. So we have the title, the abstract, and other information here. But we can also come across to the side of the page here. And this opens up something that's called the complete reference. This is all of the information about that journal article, which is inside the database. So you can see here, you have information about the people who created this. This is a publication from Hong Kong. This was published in the journal Lancet, and you can see in the center of the screen, just here, in this blue area, the information that is descriptive of this particular journal article. So what it's saying is that this is about preventing cross-infection. This is about masks. This is about severe acute respiratory syndrome and prevention, but also transmission, as you see it here. What we call these is we call these Medline subject headings or mesh subject headings as they are described here. And if I needed to use any of these to open up further information, I would be able to click these as a link. So by choosing Hong Kong, I might find more information about that location. About preventing SARS, I would be able to choose here. About masks, about transmission, you can see these items and draw on them if you need to. We can see when this first appeared. This is from 2003, and more recently it was slightly updated to insert some links into this display. Now that we've moved from looking at a list of titles to looking at a complete reference here, I could move on and I could look at more of these references if I need to. This one is not about Hong Kong, it's about Singapore. But we would be able to see similar information in the list, which is about this individual journal article, prevention of SARS, using masks, and preventive clothing as well. You can see that just here. If I need to go back to searching, I have two choices at the top here. I can go back to the search results, or I can return to searching. They tend to take me back to the same place, which is this location here. When we do a basic search like this, what we do is we take a small sample of the database and we find some useful information. And what we see first in the screen is we see the 5-star results, the ones which are the most appropriate for our particular subject or our particular question. If we only wanted to view 5-star results, we could come here and we could click this link. Or as an alternative, we can use the limits and the additional limits to be able to narrow down or limit our search. And one of the things that we can select from here is just to see the 5-star results. On this screen, you have many different types of options. You would be able to select different types of publications, something like a clinical trial, for example, a meta-analysis, or a systematic review. You would be able to select different parts of the population, perhaps by using an age group, something like middle-aged, over 45, for example. We would also be able to select from the population by gender, looking at female, looking at male, if this was something that we needed to do. And also to narrow down by publication year, being able to restrict it to a period of time. When I choose to limit the search, though, in either of those two ways, we then have those 98 5-star results that are appearing on our page, and we can see these as we scroll down and as we see them listed on the screen here. One thing that is really useful about basic search and the way that it works is that once we have created this list of 5-star results, what we can do is we can actually look inside that result. We can see which subjects occur very frequently inside that result. So if I looked inside my 98 documents and I analyzed what I see, we would be able to see that severe acute respiratory syndrome, was the second most frequently occurring type of subject, the type of mesh term that we see here. We can see that Hong Kong is up towards the top of the list. Cross-infection is here. Masks are here because these were the ways that we found this information. But we can also see that something like respiratory protective devices also appears here. So this could be a way that we could open up and we could see the type of material that is not yet being used as part of my search, but might also be interesting if I needed to look at that. We could look, if we needed to, as well, at what type of publications were frequently occurring. Most of these are journal articles. Some of them are reviews or systematic reviews and meta-analyses that we see here. And again, if I click on the little link, it will narrow down the result and give me some information. If ever you see, though, something that is really useful for you, if something really resonates with you and you think, oh, I want to find more like that particular one, what you can actually do is you can choose this link here, and it will find you some new journal articles using basic search that are very similar to this one, about hand washing, about the use of personal protective equipment during the SARS epidemic in Hong Kong. So this can really find you more of the same sort of material if this is something that really helps you and helps you explore that subject. We're going to move away, though, from looking at basic search, and we're going to try using advanced search. In the center of the screen here, this is probably the way that you are going to search most frequently if you are going to be doing research subject explorations inside of Medline. Because what it helps you with is it helps you with something that is sometimes tricky with making database searches. It helps you with locating your subjects and being able to find the ones that are useful for you. So, as I begin my exploration, we might type in something like masks. And what happens is that the software takes my words, the words that I have typed in, and it suggests the subjects that the database uses. And these are the Medline subject headings that you see here, like the ones that we saw attached to each of these references that we were looking at earlier. So if I choose masks to select, I would be selecting many of the documents that I've already seen as part of my results. But we have some extra options here. We have some things to explore. On the side of the screen here, behind these little links that have the information items on them, you can see a definition. And you could see, for example, a definition for masks. This includes surgical masks, but it does not include respiratory protective devices. These are separate things that we can look at here. The other thing that we can do is we can look at these items there. Explode, we're going to look at a little bit later, and focus. Again, we will look at when we come to a result, and I will show that to you as we come to that particular item. As I choose the subject, though, as the link, I get to see this really rather scary looking display because masks are a part of equipment. They are a part of equipment and supplies. And as we look down here, you can see that in this case, these are part of surgical attire. These are surgical masks that are first being described here. And we can know how many references, how many journal articles have been described with masks. We've seen some of them already. As we choose continue, you're able to see the next step and you're able to see the detail for masks. And so you're able to see how many individual references are attached to these more specific parts of masks. How do I supply them? Are there standards for their production and use? These are the sorts of things that we might look at here. I know, for example, that there are the adverse effects for wearing masks. Sometimes they give people a rash. If I don't choose from that list, it takes me through and it takes me to this page here. This is my first search. This is about masks. I'm typing in my next option here. This is about SARS. So now we see a slightly different display. You can see here that this is the word that I typed in, the acronym SARS. What it shows you, because there isn't a clear connection here, is that it shows you that there are perhaps more than one choice that is about this subject. You have the SARS virus, the virus that produces this disease, and you have the disease itself. So we have a choice now between these. And what I could do is I could look at a definition and we would be able to find out about that subject like we did before. And we would also be able to look at the virus. This is a species of coronavirus that we see here that was first established or discovered in 2003. So we can think about something that is really connected to our experience at the moment. What we might want to do is to choose one of these. And if we looked, for example, at this one, this is a disease. Here it is. You can see the numbers of references that are attached to it. And we could continue. I might be interested, for example, in preventing SARS. So I have the opportunity of exploring whether masks are useful in prevention or in, if we were looking at transmission, we could look at that aspect. Prevention is perhaps the thing that is most connected with this subject perhaps that I'm looking at. But as we choose, we can continue. We may also be interested perhaps in the virus itself. So we can choose it. This is a virus. You can see it there. And it's a coronavirus. You're able to see it as part of that list. And we're able to see as part of this list here that SARS is here and MERS, that Middle East Respiratory Syndrome coronavirus, is also here as well. One thing that I can do if I need to is not just to search for one thing, but to search for groups of things together. So if I wanted, for example, to search for all of these viruses that are inside this group, the box that I would tick would be this one. This one, as you can see from the top of the page, is called Explode. Explode allows me to search for things which are in categories or groups. And then in this case, we're looking at this group of viruses that are together through this list. This is not just for diseases. It's not just for drugs, you know, all of the antibiotics, for example. It could also be for groups of people. It could be for locations and places. Wherever there is something inside of something else, or it's a category, you would use that explosion function. This is the SARS virus, and we're seeing aspects of it here. How pathogenic it is, for example. You would be able to explore that from that list. Now we have the parts of our question, and we might want to bring them together because each of these, number 3, number 4, number 5, is separate. And as we choose these items, you can begin to see that these buttons start to pop up. And you may be familiar with these already. They are called Boolean operators. So if I wanted either severe acute respiratory syndrome or the SARS virus, I could bring those together. If I wanted to say I want to find where masks and both of those topics occur together, we could look at those and we could bring those together. So and finds where subjects occur together or gathers together lists of things. Hong Kong, China, Singapore. You could use or to gather those together. Masks and severe respiratory syndrome. You could find where they overlap or coexist by choosing them and bringing them together. So where we're finding masks and severe acute respiratory syndrome is in those documents that we see there, number 3 and number 4 together. And as we begin to look down, we are able to see those references and see where they occur together. Most usually, these results are in date order, with the most recently added ones towards the top of the page. So we can see something from October 2019 here, for example. And as we move down through the page, you are seeing other references occurring together. And for some of these references, you have the ability to actually link off to that journal article by following any of the links that appear here that would take you off to that journal article full text. The reason why these references appear is because they contain both of the subjects that we have used to find this particular reference. Both of them contain masks. We used that, and also severe acute respiratory syndrome. If I was thinking about the way that the subjects and subheadings occur together, you would be able to look at severe acute respiratory syndrome and prevention and control. That was part of that list that I saw you as part of that mapping process. If we were thinking about focus, which is that other box that we see when we make our selections for our subject, any of these items that have an asterisk character in front of them are the focus of this journal article. They represent the most important subjects that occur that are about this particular topic. So masks is very important. Observational studies, occupational exposure is important. Respiratory tract infections, these are the subjects that we see here. And we have these items in front of us just now. The other things that we might notice here, though, is that the author has added extra details. They have been interested also in these N95 respirators that people are perhaps wearing, in addition to the other types of masks that are available. They are also showing that face masks here of different sorts are also important to them. This list that you see at the top here was created because someone selected these subjects to describe this article. These items that you see here were selected by the author themselves to describe the subjects that they thought were important, in addition to the title of the work, and in addition to the abstract that they used to describe their particular publication. So, as we see it here, as we move back to searching, we are able to see on the page in front of us those 54 articles that are about this particular subject, bringing together SARS and masks and showing you how these occur together. Because we have opened up these subject areas before, they've stayed with us. And because we are looking at a very similar subject, you would notice that if we think of this list that we see here, which is represented in descending order of frequency, again, masks and severe acute respiratory syndrome is here. Cross-infection is here. Again, Hong Kong, but maybe a slightly different listing of subjects is also there just now. Further down, we can see which authors are very prolific, which journals, and also the different types of publications. If we were primarily concerned with a particular part of the population, though, we might be drawn here. If we wanted, for example, only to include references that were about people, I could choose this link. But behind here, we are also able to think about who the people are that have been observed. Maybe we're interested in adults or people over 45. Are we going to ask the question about whether this disease is more prevalent in children or whether children have a special need for treatment or prevention? As I choose the link, you're able to know that if I use the Shift or the Control key, I am able to choose more than one of these items. You can see that described here. We would also be able to look through the list of different types of publications. If I was interested in a clinical trial, if I was interested in a different type of trial or study, maybe looking at evaluation. Am I going to evaluate whether masks will help prevent SARS? Am I interested only in one type of document, or is more than one type of document interesting to me? Am I interested in meta-analyses, randomized controlled trials, systematic reviews? We can select as many as we need to, and we can limit the search as is necessary. So as we go through that, you can see that sometimes we actually eliminate everything, but we haven't lost it. We can always go back and we can select again, perhaps less stringently. So don't panic is a good thing to know. So just looking at adults, for example, you would be able to narrow it down from 54 to 11, and we would then be able to see a more visual representation that perhaps those 54 are either more about descriptive information on children, or they do not specify a particular age group. As I look down now, I'm able to see my results. Here they are. I can choose the ones that I want, or all of them if I need to. And then I can do something with these results. I can print them, I can email them, I can export them. As I choose a particular output method, you're going to see more detail. You're going to see how much of the record is coming to you. Whether you want to present it in a particular style, if you have a house style, and whether you want to include the search history. You can email to yourself or to someone else. And because email is an electronic source, you are able to include any links which are part of the record. And you can also have that as an attachment. Or lastly, you can export your results. And export is a way that you can take your results out and put them into a reference management tool. And so if you are using RefWorks, if you're using EndNote or any of these reference output tools, you are able to see them in the list through here. I can also use export to create a report. So if I wanted to list them into Word, or if I wanted to create a quick list of references, this would also be possible. And because, again, we are working in an electronic format, not just the printed Word, you are able to capture the references and the links that might take you to full text if that is available to you. So we've had a little bit of a look at an example. We did a basic search up here. We looked at doing an advanced search. You can see that it's labeled advanced through the page just here. We have made a combination and we've used some limits. Sometimes we've used too many. This would be a model, though, of how we would generally use the Medline database and how we can use it to find a small number of highly relevant choices about our subjects. However, there are some occasions where the subjects that appear for us are not necessarily completely going to help us with our subject and finding the part of the database that we're interested in. If you noticed in our last reference that we looked at, it was talking about the N95 respirators that people are using. And so what I did is I talked here about N95. And where it's taking me is it's taking me to a list, and that list includes things like masks, but also respiratory protective devices. We know that those are different and separate as we explored them there. I could continue to type. I could be looking at N95 respirators, for example, and that would take me to a very similar screen, perhaps with a little bit more detail. Respiratory protective devices, occupational exposure, respiratory tract infections. This is all around that subject, looking at the N95 respirators, but it may be that we want to actually search for that specifically. If I want to see where the author has used in his work those words, N95 respirators, I can choose that entry here. And what this is called is it's called searching as a keyword. So as I choose and as I continue, you are able to see that entry. Here it is. You can see that 138 references or articles are about that phrase, N95 respirators. And you're able to see inside the document itself some reasons why we're seeing this item. Here we can see that it's part of the abstract. And what we can know is that those two words have to be together. It has to be N95 and then a space and then respirators. And that's what we'll see all through our display as we see it here. It's here. It's also here. And often it is highlighted in yellow. If N95 occurs on its own, though, it will also be highlighted, but that is not the reason why you see this item. Those two have to be present and they have to be next to each other at least once. Here we're seeing respirators, but you're seeing the document because of this item that's here. So as we look at the title, as we look at that complete reference, you're able to see highlighted in yellow here the reason why we see that particular record or reference. One thing, though, that we have to know is that when I type something in, the database and the software only finds where it exactly matches to that particular pattern, to that list of keywords that we have put in with that phrase. What if the author was talking about not just N95 respirators, but N95 respirator single? Then what we see here is a slightly different list. This one is different to this one in many ways. You can see the difference between 11 and 12. And because I unticked that box, you can also see the parts of the record that it is searching inside. It includes the author's words, the title and the abstract, the original title. It also includes the subject headings. But N95 respirator is not a subject heading. If I put those together and I use OR, I can see where either of those two options have been used. Respirator, respirators. But if I look on the side of the page just here, it's going to help me because it's going to remind me that when I do this and when I search with keywords and I look for N95, what I can do is I can put something at the end of that word. So this is not just respirator, but also respirators or variations on that particular second word. So we've got respirator, respirators, and perhaps respiration as part of our results. You can see the difference between these results as we move down the page. So when you think about the ways that you can search by using keywords, which is what we're doing just here, what you should definitely think about is you should definitely think about using these items, which are called truncation and wildcard symbols. There are three. You have the question mark character. This would be respirator, respirators, so singular and plural, because that is 1 or 0 characters. You've got the asterisk character. This is respirator, respirators, and also respiration, because it's unlimited after that point. We have one other one, which is the hash mark character. So this would be organization, either spelt with an S or a Z. And by using my question mark, I could make it organization or organizations, because we can use these together. And I can even open that further. This could be organizational if I use another approach with the asterisk character. So as we look up and down this page, we're able to see the search that we made for these N95 respirators, the way that we can make this larger by including some variations. But also, we would know that by looking at the response that we see here, that if we use this option, respiratory protective devices, it's also a piece of equipment, that we would get a larger number of references. You can see it's a protective device and also a personal protective device. And attached into that, you would be able to see the subheadings, the parts of that subject. What I can tell you, because I've looked at this before, is that these N95 respirators are definitely part of this idea of respiratory protective devices. Those 201 that we find here are definitely also part of that 1991 that we see here. One thing, though, that has come to my attention is that if you are going to wear a mask or a respirator and you expect it to help you not to catch a disease, that's something that we have to be mindful of, is that beards are not a good idea, because when we have a beard, then it makes a space between your face and the mask, and it allows the air to circulate. And so it really means that you aren't going to get the benefit of wearing the mask. When we do this as a search, you can see that we have really broken this idea of the mapping tool, which is what we're using here, being able to find us an appropriate subject. It's found us hair, which is useful, and it's about men, who are people after all, but I don't know what it's got to do with zebrafish. If I tried just beard on its own, we would see something that is very, very similar. So again, this is an idea where we would have to make a selection, or what we can do is we can take the things that we have found when we looked at the N95 respirators, and we could do something like that. We could look at beard, we could look at beards, and we could do a search. And what we can know is that that 1095 all contains something that is to do with beards. One thing that kind of holds us back, though, is that when we think about beards, there are lots of different ways to refer to a beard. It could be a goatee, it could be a mustache. So if I wanted to be complete, I would have to type those in. And you would see a different result for each of those, for beards, for mustaches, maybe even for something like facial hair. At least this time, you're able to see perhaps a connection between hair and men. This is maybe the thing that we see here. So for some subjects, you find an easy connection, for some not so much. What we can do, though, is we can find where these subjects come together. We could look at these ones, and this is all about beards and facial hair. We could look at these ones, and these are all about our respirators. And we can bring those together. And what I could do, if I was really brave, is I could do something like that. Etc. Upon the page, because each thing within the brackets is evaluated separately. If I look down there, now you're able to see the material that is about this topic. And you would be able to see that there are some influences and advice about having facial hair and using a respirator or a mask. It's bad news. If you have a beard, you're probably going to have to trim it or shave it off, really, because you're not going to be able to maintain it if you need to use a respirator. As we look up and down the page here, though, because we've brought these items together, we would be able to see that the face and hair is together, but that's not specifically a beard as we see it here. Those are just descriptions that are coming together, again with respiratory protective devices as part of that list. What we've done is we've made some searches. You can see all of them up and down the page just here. This can get very long and complicated as we move through this process. So sometimes what you want to do is you want to trim the things that you don't need anymore. So as I come through here, just like I might with my beard, I can trim it away and I can remove the things that I don't need anymore. And at the lower part of the page here, there is a little link that says remove, and that trims the search and just brings it down to something which is easier to see on the screen. Because being able to do searches in a database is not just about the results that you find today. It's not just about those 13 that are available to us on this date. What you can also do is you can save the search that you have created. And the reason why you would want to save the search is so that you can run it again, or you can create something that's called an auto alert. So if my interest was on respirators and facial hair, I could save this search and I would be able to capture the process that I've made here about locating these documents. The way that I do that is to choose this button here where it says save. And what it comes back to me with is it comes back to me with a prompt. It says, to use this option, you must log into a personal account to access this feature. And a personal account is just your space within this Ovid software, within the Medline database. So if you don't have an account, you can create one. It's a self-registration process. I just give myself an ID and a password. Something that you'll find easy to remember is good. You put in your email address. Your university one is perfect. And you give us your name. This is only used for your account. It's not used in any other way. So don't think that we will be invading your privacy. What we see next, because we are saving a search, is the possibility of giving your search a name. You can add a comment, maybe the date when you made it, and you can also select to save it in a variety of different ways. If I save it permanently, it means that I can come back to it and rerun it whenever I need to. It's stored inside the account. But I can also, if I need to, save it as an alert. And then what happens is that when something new is published about my subject, then it's going to send me an email and it's going to keep me up to date with this subject as time passes. Making an alert is really perfect if you are doing a project over a long period of time, or if you are researching a subject area and you are going to do that for some months or years. As I move down the page, you can see how often it runs. You can see how it is delivered, and primarily it is delivered by email. But you can also elect to store your results in something that is called a project. So I could give my project a name. And I can add a description if I need to. A project is like a folder where you store your materials. So as I look at the email and I look at the settings, these are very much like emailing a result. The amount of detail, is there a link? How is it delivered? And then lastly, you can save your alert. What's happened is that the software now knows who I am because I've logged in. It's saved my search and it's placed that search behind here in my workspace. This is the search, the alert that I just created. And what's going to happen over time is that this is going to fill up. It's going to say, each time I am delivered some new information, it's going to keep a record just here. And what's also going to happen is that this folder is going to fill up with the new records that come automatically from my alert. What I can also do, though, if I'm a bit tricky, is that I can also use a project to store away my live results. And so they are stored inside the software, inside the folders. So I can move through the software, I can explore the journals and books and databases, and I'm able to store my information away inside a folder, inside this area called My Projects. It's just like a search result, and it's going to remain there even as you are working further on this particular subject area. So we've had a little bit of an exploration. We've looked at making a basic search where you type in a subject or a question. We've looked at an advanced search, and we found that there are two ways to make a search. There is using a keyword, and there is also using subject headings. And you can use both if you need to create a very large result. As well as searching in that way, there are different methods of searching for authors, for words or phrases from the title or the name of a journal. But for most of you, you are going to want to search for subjects. This is primarily why you use a database. We've also explored that once you have created a search, then you can narrow down that result. You could look at particular age groups. Though, if we're doing searches about beards, they're mainly going to be about men who are adults. This is going to be our primary population. You can also see, though, that there are different types of publications, different broad subject areas, and other ways of using this material through this list. A limit would often come at the end of a search, though. So we could, for example, just see which of our results have been added since 2014. So only 2 out of those 13 are very recent. Across the rest of the page, there is Find Citation. And Find Citation is about finding an individual reference. So if you have some words from the title, the name of the author, the name of the journal, the volume, the issue, the page, all you do is plug in that information and it will find you that individual reference. And maybe find that it has electronic full text attached to it. The item in the middle of the page, though, here, is called Search Fields. This is the opportunity for you to search across any of the fields within this database. Often people are bowled over by this display because it is very complicated. But a really good one to remember is this one. This one is called Institution. And institution is about the location of the author. So we might be wondering about authors that are located in Hong Kong. So we're looking in the institution field for authors in Hong Kong. You can see that number there. So Medline, this database that we're looking at here, is not just a theoretical thing, it's about real people in real places. And so you are able really to look for a particular person. What we have here as well, though, is we have the ability to connect Hong Kong with those respiratory devices that we were exploring before. So it might not just be about subjects, it can be about people in a particular location. So here we're looking at a publication that's about nurses wearing these N95 respirators, and that particular publication was created by someone in Hong Kong. And some of the other ones that we see there may be from the Baptist University as well. Well, I'm almost through with what I have to say. On the rest of the page, as we look at it here, as well as being able to search inside the database, we also have some help. And the help is about the software that you are using and the way that you move through it. So if you are searching and you want to know more about basic search, this is a place that you could look. Next to that is the support and training area. Here it is. And if I wanted, for example, to look at some information about products and the way that they work, and perhaps I wanted to look at someone looking at Medline, I could look at a small video just here. Or if I wanted to explore the user guides, the printed material, which is available, I can look here. And of course, if you would prefer, there are also language user guides available from the side of the page just here. That fairly much, though, brings me to the end of what I have to tell you just now. Just to bring it to a close, though, one thing that I wanted to point out is that this is from the FDA, and so they are really suggesting that the general public not use N95 respirators or surgical masks, really because unless there is a reason, these can cause adverse effects as well. And of course, if you do determine that you are actually interested in wearing a mask, you have to be mask ready. And that probably means that you're going to have to trim your beard if you have one. And of course, there are very many guides to the types of beards that you can and you cannot have. For example, you can be a villain, but you have to be careful not to cross the seal. So that brings me to the end of what I have to show. And so what we can definitely do is we can take some questions at this point.